Hi guys, Bertrand here from the Musculoskeletal Physiotherapy Australia. Just like to give you a fresh new video. We're here at the Prince Charles Hospital and we have just finished teaching the Mulligan Concepts course. I assisted Grant here today. So what you'll get out of from this video is what the Mulligan's technique is and how it can help treat your condition as well. So Grant here is an accredited Mulligan's Concept teacher. And let's hear from Grant what the Mulligan's technique is all about and how you can benefit from this very own technique.
Yeah, so the Mulligan Concept was invented by a physio called Brian Mulligan in New Zealand. He invented this unique technique where we combine mobilisation to a joint with a movement. So standard physiotherapy you may be used to, we're applying a technique manually to you when you're lying on the bed. With this technique, we are doing it in a functional position where you're upright or doing what hurts you, and then we apply the technique to you, and then we take away your pain instantly with this technique. So it's a pain-free, instant procedure that produces long-lasting results.
Fantastic, yeah. And so what type of conditions can the technique be used on?
Yeah, so any technique where there's pain and restricted movement in the body. We have techniques for tennis elbow that have research backing. We have research backing cervicogenic dizziness, that the effects of therapy and home program are maintained at 12 months follow-up. We also have 12-month follow-up for headache technique for cervicogenic headaches, a headache induced by a problem in your neck. We can use it on any part of the body, from your headaches in your neck right down to your big toe.
Yeah, that's right. And it's a very powerful technique. And it's very important to note that this technique is backed up with evidence. So a lot of researchers have taken this technique, done research, and have proven that this technique does work extremely well.
That's right.
And a very important thing is that, if you do have injuries, chronic pain, or even acute pain, that you've seen a lot of allied health professionals and it hasn't helped, then perhaps give the Mulligan's technique a try. A lot of physiotherapists do this technique. Today, for the past 2 days, Grant has been teaching. He's taken on board about 11
Yeah, we had
participants.
11 physios and 1 medical doctor. She was very keen to learn the techniques and take them home and apply them with her patients as well. So yeah, it's been great.
That's right. So the Mulligan's technique is an amazing technique. At our clinic, we utilise this technique quite significantly because it does achieve outstanding results. As Grant said, we follow something called the acronym of the PILL, P-I-L-L, which is basically pain-free, instant change, and long-lasting results. So if you have not tried the Mulligan's technique, then do see someone who does the Mulligan's technique, as you'll get amazing results.
So you can ask if your physio is qualified in the Mulligan Concept technique, or you can look on bmulligan.com and you can find a list of certified Mulligan practitioners there.
And for those physiotherapists who follow us here, Grant, can you tell us a bit more about how many courses there are either towards the end of this year?
Yeah, for sure. So we've got one in Sydney that's fully booked. We'll have courses in Canberra, Port Macquarie, Sydney, Melbourne next year, and we have a Brisbane course in July next year we've locked in the dates for. So you can find those dates on, again, that bmulligan.com website, or you can look at the Facebook page for the Mulligan Concept in Australia. So it's facebook.com/Mulligan Concept Australia, in one word.
Very good. So guys, 2 take-home messages for you all. For those of you who do have injuries, persistent pain, acute injuries, then do try the Mulligan's technique, a very, very powerful technique with instant change. And for those physiotherapists who do follow us, then again, jump on board online and book yourself in for the course to get some outstanding results for your own patients. Great guys, well Grant, it's been a pleasure assisting you on the course. A wonderful teacher and has helped a lot of participants over the past 2 days. Great.
Thank you.
Thank you.
There you go.